And now we're going to look at how one issue in one race is playing out. The tobacco industry is pouring money into Montana to fight a ballot initiative that would raise tobacco taxes to pay for Medicaid expansion.
When we look at Montana and Nebraska, both of these states worked on Medicaid expansion, which is a federal policy. The outcomes are very different. In Montana, you have a less robust ecosystem for civic engagement.
Folks were reluctant to support the tobacco tax that was paired in the same ballot measure with Medicaid expansion. And at the same time, it invited big tobacco money to fight the ballot initiative. And I think folks there really underestimated just how much money and how big a fight tobacco was going to put up. And it was a big one.
Altria Client Services, the maker of Marlboro cigarettes, put another $3.5 million into the campaign against I-185 last month, upping its total to $7.5 million.
In addition, Montana is a very white state, but it has an important indigenous population. And tobacco is a sacred product for Native folks. There had to be a lot of explaining and educating around which tobacco products would be taxed, how it would affect indigenous ceremony. And so that was also a bit of a challenge because at the same time, the Native community up in Montana absolutely benefits from Medicaid expansion.
I would just like to thank all of you for working diligently and fighting for Montanans, fighting for healthcare. You have written LTEs, you have given testimony, you have driven from all over to the four corners of Montana to be here today.
If I could leave you with one thing today, is are we protecting our future, or are we leaving them a mess? We must strive forward for health care for all of us.
These were some of kind of the tensions that existed in Montana and ultimately led to the defeat of the ballot initiative. Luckily, it did later pass, and so, you know, there's still a win there, but it wasn't through the ballot initiative itself. Nebraska is a very rural state and, you know, kind of conservative state, right? And so we kind of traditionally think of Medicaid or big government as more progressive policy, and yet they were able to pass it there. And they had some really key partners on the ground.
We are here outside the Capitol getting ready for the hearing for LB 441, which is the Medicaid expansion bill. I'm Kate Mattson, and I am a healthcare organizer at Nebraska Appleseed.
The state of Nebraska is another of just a few red states with Medicaid expansion on the ballot, and soon voters in the Cornhusker state will see if they can do what their elected officials have been unable to.
I tweeted out, hey, we're gonna bring a Medicaid expansion ballot initiative to Nebraska. Maine can do it, we can do it. And then it was interesting because it gained a lot of traction, and then some national folks messaged me back and said, hey, we'd love to come to Nebraska, and we'd love to test the waters and see what kind of infrastructure you have and if we can do this here.
You have an organization that has deep roots in lots of different communities and a broad network of folks in the ecosystem who are able and willing and ready to play.
My advice to funders who are trying to build power and get ballot initiatives done is to fund them before the year they're happening. Especially in a state like Nebraska, we have 2 years to collect signatures. Getting that funding 3 years out would be huge. It would be amazing. It would allow us to hire people and prepare our campaign. Also to focus on giving funding to BIPOC-led organizations, because the BIPOC organizations are the ones that are talking to folks in the community. They're the ones who have the connections. They're the ones who can actually make it happen.